All right. Hey, everybody. It's Marilyn Green. You know me. I'm the girl who don't you know. So happy to have you guys on board today. And we have a exciting show that's coming up. Something that's kind of dear to my heart because I am in the health field. For those who don't know my background, I'm a dental hygienist. Always wanted to be a dentist since the third grade, but decided to go the route that was preventative. And what I'm going to be talking about today is about prevention, basically, about your health and your health outcomes. I have a dynamic, outstanding, wow, I can't think enough positive words to talk about my guest. And guess what? You know, I always want to know where you're from. Okay. So put something in the comments and tell me, hey, how you doing or something. Let me see who's watching. I see Sky Mitchell. I'm watching. Okay, much love. And Annabelle, hey, how you doing? Good evening to you. Who else is out there? If they're not out there, they are definitely going to be coming. Because if not, you can always hit that hashtag replay and you can get to hear some of the outstanding information that she's going to share today. So, also, because today is April the 4th, we know April the 4th, I think it was 1968, that Dr. Martin Luther King was slain in Memphis, Lorraine Hotel. So, we need to give some time, a few seconds of being quiet to just remember that and remember how great of a leader he was and everything that he did for us. All right, so we cannot forget Dr. Martin Luther King no matter what. Let's see who else we got in the comments here. Um, Ma Green, it's me. Is that Michelle? The Michelle I know? It is the Michelle I know. I won't say your name trying to protect you. You know, you might be running from the law at this point. I don't know. But hey there. So let's see here. Let me go back to my banners. And so we're going to start this show off and make sure you interact in the comments. We want to hear from you. Okay. And you know that my show is always trying to transform your mind one show at a time. And hey, you might say, you know what? I want to be on your show. And guess what I say? I want you to be on my show. So let me know. Write me. And I will say, hey, let's get on this show here. So, and also while you're sitting here waiting, how about if you tell a friend? Health outcomes, health literacy is something that we need to talk about. Okay. And the reason why I really like this subject as well is because of COVID-19. Everybody became quote unquote Dr. Fauci. Okay. Everybody knew just a little bit to be dangerous and not enough to really take care of themselves. That just did not happen with COVID-19. Okay. That's been the case always. People know a little bit and they're dangerous, and then they don't know enough, and then their health becomes very dangerous. So today we have this person on who is a patient advocate, and hey, she's gonna tell you how to look for the things that you need to look for, how to get a voice, how, I mean, she got some stories that'll tell you like, oh my goodness. Okay, but nevertheless, I'm going to bring her up, and I'm going to bring her up right now. I see her. Hey,
Thank
Dr.
you,
Jones.
Marilyn. Thank
How you
you.
doing?
Girl, I am doing wonderful. I am honored to be here with such a big shot caller like yourself. Um, I have admired your career for a while, and so now I'm stepping out and stepping on faith to do just similar to my sister and the great work that you've been doing. I'm
Wow.
just really proud. Yeah.
You know what? I feel the same way about you because, you know, I've always thought you was a big baller shot caller.
No.
And you are that person. You know, right now, ladies and gentlemen, you see her, she's in a hotel room because she travels a lot, and she does some wonderful things out there. Unbeknownst, she's a behind the scene person taking care of a lot of things that you just don't know about. But one of the biggest things she wants to talk about today is patient advocacy. So I'd be remiss if I didn't show you everything that Dr. Jones is all about. She got it from A to Z. Dr. Jones, unpack it for us. Tell us what DHSC and MSN, ABC, CDC. Go
Listen,
for it.
I am humble and I'm only talking about it because you mentioned it. God is good. So I have a doctorate in health science. My focus is on patient safety and a master's in nursing. I was a women's health nurse practitioner and practiced 10 years. Lean Six Sigma Green Belt is a way that we kind of help with putting, how do I say it to make it easier? It's about a process and a system that hospitals can do to have better quality of care. And then CPPS, I am actually a certified patient safety person. So I can go in hospitals and look at safety and quality to tell the caliber of a hospital that we're working with.
Wow. I knew she had so many. I said, I have got to get this ABCD. I said, oh, that's a whole lot. Okay. So as you come in, we're going to be talking with Dr. Brenda Jones today. She's a patient advocate, and she is going to share a PowerPoint with you. And she has some stories that have you like, oh my, really? Okay. So I'm going to put her screen up now.
And so, Marilyn, while you're doing that, I think the emphasis for me is the Bible talks about my people perish for lack of knowledge.
Yes.
And I think the trajectory that I'm on, volunteering at churches, volunteering at different places, to really help us as a people start to understand how we can speak up and advocate for ourselves. So what I'd like to do is, and thank you, Marilyn, again for the opportunity. I'd like to share what hospitals are doing, but then what can you do as an individual to help protect you and your family?
That's right. And we got a person here, Marcy Williams. Hi, Marcy. How are you? And let's see here. We got Brenda Eddings Bay. Wow. I have a green
She
belt.
got a green belt 6
Hey,
Sigma.
wow. And her name is Brenda too. Okay, Brenda with the green belt 6 Sigmas. That's what we have to call you guys. Okay. So I think Brenda is all the way out there on the East Coast. What is it? New Jersey, I think, or New York. And then Marcy is in South Carolina. One of them crackalackies. I know you're one of them. But no, nevertheless and stuff, I'm happy to have you guys on here. And please share it with a friend. All righty, let's get back here. And we're going to start off with the PowerPoint. And so
absolutely.
You let me know how you want me to move it.
Absolutely. So we'll go to the next one.
Okay.
So guys, I want to give you just some definitions just so we're all on the same page. When you go to a hospital, we want to make sure that there is no harm that comes to you. So patient safety is really looking at keeping patients that come to the hospital. If you come for a diabetic test, then that's the test that's done, not something else or something that could harm you. We want you to be 100% coming in and coming out the same way and or better. Adverse event, these are the harmful things that happen. You come in, surgery is on the wrong site, or you're giving the wrong medication. This is really at the top of all of the hospitals, what they're focusing on. And then patient and family-centered care, this is where the hospitals, the doctors, the nurses, they really need to make sure that your voice is heard when you have issues or questions. And they need to make sure that they value what you say and look at your preferences. This we don't do enough of, shared decision making. Medicine is very paternalistic. We tell you what you need to do. We tell you how to do it. We don't really ask you and get your thoughts. So shared decision making, and I want you to keep these definitions because shared decision making is what you should say to your doctor. Hey, can we work on this together? Can we make decisions together? You don't just tell me what to do and I do it. I need to understand. I need to be a part of my care. I need to be a part of my mother's care or my sister's care. Really important. And then patient experience, hospitals are really focusing on this because financial performance strengthens their customer loyalty. It helps building their reputation and brand and boosting hospitalization. Now, you know how the community is. If they hear you did something, that word gets out, that flies faster than
You
anything
done.
you could read or
You
write.
done. It's a wrap. It's a wrap.
It's a wrap. So we want, and you think about it, if you came out of the hospital, we would really want to see, say we did a Yelp. I'd want to see good comments. I don't want to see they didn't change my linen. They didn't give me the right medication. When people read things like that online, they wouldn't want to come back. You wouldn't go to a hairdresser if every person that, responded and said my hair was jacked up and the perm was messed up. You wouldn't do that. So we feel the same way about hospital care.
Mm-hmm.
The next slide.
All righty.
So some of the issues, and this is why I am so passionate about this, COVID has really took a number on us.
Yes.
Staffing shortage is like you wouldn't believe. Nurses turnover is about 20%. Staff that are like secretaries and techs, they're leaving hospital jobs because it's minimum wage to go to places like Chick-fil-A, who'll give them $18, $20 an hour, pay their school tuition. Why would I work at a hospital and I'm going to go to Sonic and all these different places, Amazon, and make more money? So we're seeing that in hospitals in droves. We're seeing nurses who are retiring and saying, this is too much. I can't handle it. And so because of the staffing shortages and physician staffing shortages, we see a delay or a misdiagnosis. We see people that come in for one thing and they're telling you what's wrong and you don't have time because you're so stressed out because you have so many patients, you have so much to do. We're seeing errors. We're seeing hospitals actually do errors. And so to protect yourself, you've got to be involved in your care. You've got to ask questions. You've got to share what your thoughts are. I just think it's really important. And if you have a mother or a father that are, that goes to the hospital, you're going to really need to help and be there and ask the right questions. I was sharing early on, and I think I mentioned this to Marilyn years ago. My mother had just had a mastectomy and she was in the hospital. And I don't go in saying I'm a nurse, because, I think you just need to be a silent watcher. Mm-hmm. And the nurse walked in the room and she says, "Good morning, Mrs. Morrow. I'm going to hang your meds." And I said, "If you don't mind me asking, can you please tell me what medication you're hanging?" And she said, "This is her insulin drip." My mother is not diabetic.
Oh.
Had she had got that insulin drip, it would have brought her blood sugar all the way down and she could have ended up in ICU simply because she had just had surgery and she was already labile. And then to do this would have been more.
Wow.
And while I'm talking about that nurse, I also want to talk about things that I've done that have changed my career. I was actually passing meds as a new nurse. We were short-staffed. I was asked to stay over, so I was already tired. I was mixing the medications. We didn't have the barcode scanning and things at that time, which help you make sure that you got the right patient from a technology standpoint. Mm-hmm. But I mixed the meds and I took them to the room, and an older Black gentleman said to me, "That don't look like my medication." And I said, "Really?" He said, "No." He said, "I have a pink and a yellow pill." And
all right,
those look. So he didn't know the names.
Right.
And so I took those medications back. Now, for those that are nurses or in the hospital, we're supposed to look at the name, the meds, and all of that. We've come a long way. This was over 30 years ago. But that experience resonated with me, because had he have not asked, I might not have found out that I indeed was getting ready to give him the wrong medication. I could have killed or hurt him. I could have lost my license. And I thanked him and I told him, every time you go to the hospital, every time you go to the clinic, I'm going to need you to do that. And I was transparent with him and I shared that I was sorry. And my God, nobody wants to hurt anybody. Mm-hmm. But I can tell you that man probably saved his life.
Wow. Wow.
The next slide.
That's impactful there because, and a lot of times when you talk about the colors of medicines, you don't know the colors, but when they say pink or yellow or green or whatever, even
Yes.
though we know manufacturers sometimes change the
Yeah.
color,
Yep.
still the fact that he knew that that color was not the color, and he
That's
had
right.
enough voice to say
That's right.
that don't look like my stuff, okay?
That's right.
And
That's
that thing about the insulin drip, all of that stuff be looking like water, okay? So
right.
you got, you know what I'm saying, water. So you got to know exactly. Okay, so what are you doing? What are you giving them? And some of them get a little snippy with you, and
They
it's,
do.
but you got to be just like, hey, look, I need to know, okay, and
And
what is
Marilyn,
it
you bring
for?
up an excellent point, because I could have said, I'm the nurse, I mix these meds, manufacturers change, and you need to take these medication. Now, obviously that wouldn't have been the right thing, or it wouldn't have been the best thing for that patient to for me to talk that way. But there are some people that do, and you have to persist and you have to
Yes,
say, no, I'm gonna need you to go back and check that out. So
that's
you're
right.
right.
Yeah. Okay, let's go to the next slide. Okay.
So this is really, to me, extremely impactful, because I want to share why you need to advocate for yourself. We know that medical errors are the third leading cause of death in the United States, to cancer and heart disease are one and two. But medical errors, these are things that didn't have to happen. That you
Mm,
come to the hospital for one thing and something else happens. Medication errors. 1.5 million Americans are injured annually because of medication errors. I just gave you two examples, but there's many, many more. And so we want to make sure that you understand what your medications are. Sometimes, and I don't, if there are any doctors on, I totally don't want to make it seem like doctors are making mistakes, but the examples that I have are just what happens in healthcare. My grandmother was on medication, and for anyone that knows my grandmother, she was a pistol. She was something else, and
yeah, a
whatever
pestle.
come
Come
up,
on
come
with
out.
it. Okay.
Yes. And so we were at the doctor's office, and the doctor said, "How are you feeling?" My grandmother had heart failure. And so she said, "I don't know. I'm just," and excuse my French, but this is what she said to him, "I'm pissing like a racehorse." And
Okay.
it went over his head
I love
because
it. A racehorse. Go
a
ahead.
racehorse.
A
And
racehorse.
we do know racehorses do get um diuretics so that they will not have to stop and urinate when they're running. So there
Okay.
was context to it. And I didn't know that until maybe 2 weeks ago when I was preparing this. But he didn't hear it. I think he just thought she was just senile, and he just dismissed it. But what had happened is I looked at her medication. They're supposed to do what's called a medication reconciliation, meaning they look
Okay.
at all the meds and make sure what she's taking is accurate, because you will sometimes have two, three, four doctors prescribing. So they should be looking and evaluating and making sure. What I discovered after she was discharged is that they were giving her Lasix and furosemide, which are the
Oh,
same drugs. So
wow.
she was getting diuresed, or making to urinate to relieve some of the water from her heart and lungs. They were giving her way too much, and
Wow.
they didn't catch it. And so family members have to look and say, what does this drug do? What does this drug mean? Because had I not been there, I don't know what would have happened. She could have become severely dehydrated
Hmm.
and or had a stroke from that over medication. So
Yeah.
it's
And
really important.
Dr. Jones, also when you talking about diuretics, it not only takes from those two parts that you're talking about, right? It can
Mhm.
take from other parts as well, other
Absolutely.
organs. And that
Absolutely.
dehydration, and a lot of people are
Yes.
dehydrated, they don't even know they are.
Absolutely.
Dehydration is huge. It can make you
Absolutely.
dizzy. You can't sleep well. It has a whole lot of ramifications that we don't even consider, because I can just say strongly, a lot of us do not drink enough water. I'm one of those. But anyway, water is so important. But I want to stop right now, and I want to put somebody up here who's saying she's listening in. It's Pat Martin, and she's supporting you, Brenda. So you know, okay? Can you see it?
Yes. Mm-hmm.
All right.
Hey, Pat.
Okay, then. Go right. Thanks for joining, Pat. Okay, so go right ahead.
So another thing that I really want to talk about is an estimated 2 million patients contract a hospital-related infection. That means you came to the hospital and you didn't have that infection, but you got it while you were there.
Wow.
And one of the number one ways to reduce contracting an infection is to wash your hands. And so
Mm,
CDC says almost 50% of providers, nurses, doctors, techs, whoever comes in that room, do not wash their hands. The numbers are very low of compliance for hand washing, 50 to 60%, somewhere the data shows. So there is nothing wrong with you asking your doctor or your nurse or whoever's coming to draw blood. If you didn't see them wash their hands, please speak up. Please say, can you please wash your hands? Now, Marilyn will know I love to tell stories because I've been in healthcare a long time. My mother was having eye surgery and she had had some problems. So we were very careful and cautious in watching. And the doctor, who we absolutely love, and she's been going to for such a long time, walked in the room. He had residents, and I know he was busy. He had a lot going on. But he literally went for the sterile field where everything is supposed to be clean and sterile. And he went to grab something, and I said, Doctor, can you please wash your hands?
wow.
And he said to me, I know better. I am so sorry. He said, I will go and do that. So, what that does is it builds trust, it builds relationship. He didn't tell
Mhm.
me I'm the doctor. You didn't see me. I washed my hands already. Uh, he could have,
You
but he
could have.
didn't. He didn't. He didn't. And so that means that we're human and we make mistakes and that we sometimes forget. So, why can't you as a patient say to them, I'm gonna need you to wash your hands. There's
Mhm.
nothing wrong with that.
Nothing. Dr. Jones, what do you think about when they come in the room and they already got the gloves on? You don't know whether or not they wash their hands. That's one thing. But also, how about if they come in, don't wash their hand and put gloves on?
So I think that there is nothing wrong. And if you're in a hospital that gets mad because you ask someone to wash their hands, then we got a problem. And that
Mhm.
might need to be a supervisor or someone if you're disrespectful to me because I asked you to wash your hands. It's for my protection. I
Mhm.
don't want to be sick. When
Mhm.
we have people that end up with any of these things that I have on this slide, short of being dead, they in the hospitals much longer, they're sicker, and that sickness and medication causes another sickness and medication, and so
Mhm.
on and so on.
Mhm.
So what is the big deal for me to ask you to wash your hands and you not just wash them, and I feel better about my care?
That's right. That's right. That's a good thing. Yeah. Yeah. You're
Yeah,
right on that one. Simple. Simple, but we find that people don't want to say it because they're the doctor, quote
that's
unquote, and they
exactly
know
right.
that, but they're
That's
humans, okay?
that's
And if you
exactly
don't
right.
speak up, who's gonna speak up for you? So
Totally agree.
go
Totally
ahead.
agree.
Mhm.
And one of the other things that we're seeing in hospitals still that 25 to 52 wrong site surgeries are performed each week. So that means either I took the wrong leg, the wrong breast, I didn't mark the right site. When you're having surgery, you're going to engage with your provider. You're going to make sure that everybody is on the same page. When you go into surgery, they do what's called a timeout. That means everybody stops what they're doing and they look and they make sure it's the right patient, it's the right limb, it's the right, everything has to be perfect. And that should be happening. But somehow in hospitals, that's not happening.
Wow.
My neighbor just had eye implants, and I don't know to what extent they were, but he wasn't able to see quite clearly afterwards, and he kept saying something's wrong, I don't know what it is. He went back and forth for over 2 weeks, 3 weeks, and finally the optometrist or ophthalmologist admitted that they had put the wrong lens in his eyes. So
Wow.
obviously they
Oh.
did not do timeout. And I'm so
Ooh.
worried for him because he said if they remove them, and I hate to make the analogy of such, but it's kind of like a peanut butter and jelly. You know, when you put that sandwich together, when you take that top bread off, peanut butter and jelly all come
It's just
together.
mixed.
And so he's saying that they told him that if it gets removed, that he could lose his vision.
Wow.
And so this is happening, and I can tell you many, many more stories. You can look them up. We are still doing wrong site surgeries, and this continues to be an issue in the United States.
Wow. Oh, that's scary. I mean,
Yeah,
I just want to tell everybody, this is not to make people afraid. It's
absolutely.
really to make people aware. So we're using the two A's, afraid, okay, and aware. We want you to be aware of your rights as a patient
That's
to
right.
say, I need to know what's going on. This is not working for me, or whatever, I mean, it's the same thing if you're in a dentist, they pull the wrong tooth. Really? That's not even the tooth that was hurting.
Absolutely.
I mean, so
Absolutely.
all these things happen and you got to be aware. Let me see what Anna said. This is such valuable information. Okay, Anna. And Marcy says awesome information. And let me just say this, we know this information, okay? And so knowing, and she says facts as well. We know these things, but sometimes we have to be brought to remembrance again. Okay.
Yes.
Some things we know, some things we don't know. But the things we do know, sometimes we kind of fall off a little bit too and get too trusting with a doctor, nurse, or whoever,
That's right.
and we forget that we have opportunities to share our progress, basically, of getting better. That's all they're supposed to be doing, is trying to get us better. So yeah.
Absolutely,
Mhm.
Marilyn. I think that, and that's what we would all want. We go in, we're expecting to have care that is safe and the quality is top notch.
Right.
And if I could get nothing else on this slide, the sad part about it is the research shows that 40 to 50% of those things that are happening, they are preventable. That
Wow.
means you do have a part in there speaking up. You do have an opportunity to say something. These things are preventable, and it's human error, and we make mistakes. I never wanted to hurt anyone by giving that man the wrong medication, but there are all these things, extenuating circumstances that happen. It's short staff, not enough people. My mind is on what I got to do the next shift and what I got to do. And so we put things in place, systems and processes, but somehow human error, it goes around it. So by you asking for, and Pat's a nurse, so she'll know, whenever we as nurses, and this is back in the day, I haven't worked bedside in a while, but believe me, it ain't changed. That family that always asks questions, that's always writing stuff down, saying, what are you doing with my mother? And what's the plan today? Those are the ones that it seems like healthcare workers pay a little more attention to.
That's right.
They,
They
they
do.
ask those questions because they want to understand. But then the other team, the hospitals, some embrace it, but some say, "Oh, when you go to that room, their sister always asking questions, or they're asking questions about their mother, as if it's something bad." It's actually good. It's actually good.
I mean, who are they supposed to ask about their father? He's not in the hospital. But it's almost as if they're getting insulted, if you will, or getting
Exactly.
offended by the fact that we're asking you questions. That's what you're there for. And let me add this. Another thing, when we go into the doctor's office, one of the things that I mean, I'm guilty of it too. The doctor come in and he'll ramble off, you need this, blah, 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 blah. They
Yes.
don't ask one question.
Mm-mm.
Time that doctor goes out, what do they do? Well, what did he talking about? And what did he say? And all that and stuff. We have got to stop this. That
Yes,
doctor is doing it.
absolutely. Absolutely. He
You
can't
know
be
what
too
I'm saying?
busy. Yes. Oh, Marilyn, you're right. And here's the thing. Just like you said, the doctor walks out and has a conversation. Now you're asking the tech or the nurse something that should have been And I'll give you another example. My and I have to use my mother's my test baby because I'm always in the
Okay.
hospital with her. I'm
All
just
right.
saying.
Okay.
And we were in the hospital, and I had came to visit her, and I was sitting in the room. I should have known something because the provider walked right in, didn't speak to me. Okay, I let that go. But he had asked the nurses the night before to get a consent for her to sign for a procedure. Well, she read and the consent and said, I don't know, I'm uncomfortable. Well, the nurses are not able to explain risk versus benefit. It is out of their scope of practice.
Okay.
It is not what they're supposed to do. So he came in visibly angry because
Oh,
she didn't sign it. So I look and I was like, I'm gonna let my mother handle it because we done worked well. She knows how to advocate for herself. So
right.
we watched him, and she said, well, he says, what's the problem? Why, I have other cases. Why didn't you sign this? And I just looked and I thought, Mama, you got this because I'm about to snap. And he
Bust the cap
said,
on him, Dr. Jones.
but
Bust
oh
the cap
my
on
God,
him.
you
Bust
messing
the
with my
cap.
mama.
Okay.
Exactly. So her and I were sitting there, and he was very angry, and we took care of it. And she didn't end up having the procedure. But what I did after that is I went to the nurses and I said, I'm very saddened by the fact that you, as a nurse, would ask for a consent to be signed. I said, that is out of your scope of practice. And they said, well, that practice, that doctor always does this, and we didn't know. So that is what we call a culture that won't allow safety, because you should be able to say, that's not my responsibility. I
Mhm.
can't get that. That's yours. So maybe you should come in early or call her on the phone and I'll witness.
That's
But to
right.
come in and be angry about it was unbelievable.
Well,
Unbelievable.
I like what Jacqueline Morrow Kinkle is saying. Doctors are practitioners. She put it in caps. That means she meant that. And
Uh,
meaning they don't always get it right because they are practicing.
Whoa, I never thought about that.
Yeah, yeah, they
That's
are
true.
practicing medicine. And
Absolutely.
we are the quote unquote guinea pigs,
Ah,
okay? Guinea
and
pigs
and
don't
and
talk,
and
but we can.
absolutely. And I'm going to tell you, we have some powerful nurse practitioners, powerful doctors. Please don't take this disparaging. But I think I've had enough bad experiences with in and out of the hospital with my mother. And as somebody that sees hospitals quite frequently in my travels over the years, as a nurse, as a person that goes and looks at hospitals, I think we all want to do the right thing, but I do think there's opportunity.
Yeah,
Next slide. And some of that opportunity, I have to unpack this because this is happening. um, Bias.
yeah.
Bias is the automatic, and that's the next slide, Marilyn.
Okay,
It's
hold
the
on one
automatic.
second. Let's not go forward yet. So Pat Martin said, also, I want to express the importance of collaboration with pharmacists who play a very important role in the patient's care coordination team around
Yes,
safe medication delivery. Most people are not aware that most pharmacists are Form Ds.
absolutely.
Okay,
So
yeah,
those pharmacists could be teaching you and helping you understand your medications. Some of us take medication, we feel better, we stop taking it. And so the PharmD can tell you, no, you have to finish your course of medication. So thank you, Pat, for that.
that's right. And they do that in some pharmacies. I won't name one, but they say, do
Uh-huh.
you have any questions for the pharmacist? Okay.
Yes,
They ask us if we have questions, but we don't know what questions to ask. It should be the other way around. Let me tell you this.
that's right. That's right.
Okay. I don't know. I don't know
Because
what
I
to
don't know what
ask.
I don't know.
I can't. And then they have so many little small words and stuff. And I'm like, I'm in pain. I don't care. Give me that Percocet. I don't care what it does to me. So
Absolutely.
that's where it is.
That's exactly
Okay.
right. So we know that the automatic reaction we have toward other people is based on what our experience is. We just call this in healthcare what it is. It's racism. It's stereotypical thinking, and providers can have that. And we know that some of those stereotypical things can cause a lot of opportunities. The next slide.
Okay, let me stop and get this. I got to
Yep.
get this. Yes, girl. Yes. I love it. I love my audience. Absolutely.
That's another
Okay.
nurse there, Dr. Conway.
Dr. Conaway, how are you? Absolutely. Okay, I'm
Yes.
gonna give you the next slide. Let's go there. Okay.
So we know that the negative impacts of bias cause inadequate patient assessments, improper diagnosis, and treatment decisions. Because I think and I'll wait to the next slide to talk about that one. The less time involved in patient care, I'm just going to go in, see you, and get out because I don't value you as an individual. And then patient discharges with insufficient follow up. Who do I
Oh,
call? Don't ever leave a hospital without knowing who to call. If I'm bleeding or something happens, what should I do? Who do I call? What should I, where should I go? Which is the nearest hospital that can handle that? A lot of us leave the hospital with that. But the one I want to focus on is the inadequate patient assessment.
okay.
We had a colleague of mine who is a nurse, she's a nurse practitioner, and we both worked at the same practice. And she went home and she got very ill. She didn't know what was happening. And her husband said at some point she became faintish. He said, and she just looked green. She just her face color, she
Green.
was
Did you
bright.
say green?
He said green. He just,
Okay.
he was scared.
Okay. I've heard of ash and
What's her
gray.
normal color?
Okay. All right.
And
Go ahead.
Marilyn, he took her to the emergency room where she was in and out, just in and out, in and out. And all the providers said was, "What drugs did she take? What did she take?" And he's like, he's crying because he's seeing his wife, what looks like is dying. He said, I don't know what you're talking about. She don't do drugs. I need to know. You have to be honest with me. He assumed that she was on drugs. Now we're talking about stereotype and how this could have cost this child her life. He calls the doctor, who is our collaborating physician. He comes in immediately after doing an assessment. That doctor knew right away that this was an ectopic pregnancy. She was bleeding in the belly, and that's why she was going in and out. And
Ooh.
that, for me, right there was devastating because I knew her and knew that she could have died. And it
Wow.
was because the assumption that she was doing drugs. And this was, and I have to be honest, it was inner city hospital. So the thought was, if somebody of color comes in with this look and what was going on, the assumption was made. It was harsh judgment, and it was made inappropriately.
Wow.
And the more they played around, the more they could have cost her life. And I have seen other situations like this more honestly than I care to. Again, I have to use my mother as an example. She was going to a cardiologist for many years. And as I started going to hospitals and seeing how cardiology services worked, I thought, she has never been asked to go to cardiac rehab. And I have colleagues who have, family members that had the same diagnosis, and they were going to cardiac rehab to strengthen their heart, help them with the rehab and get better. She was never offered that. So we immediately switched physicians.
Wow.
You cannot be afraid to move forward if you're not getting the best care.
I love that.
It delays, it delays you from getting better and reaching optimum health.
I like that. And let me put it on a spiritual tip. You cannot be afraid to move from a church just because your mom and them used to be there forever, but you ain't being fed. I have to throw that in. I don't know why I thought about that. It's true.
Yeah.
Don't be afraid to move so you can get spiritually fed. Just like a doctor. Don't be afraid to move. I've had it for years, and it was my mama's and my daddy's and my kids and all that kind of stuff. Let me see what Pat Martin is saying here. Racism, stereotypes, and patients with language barriers. Preach. Okay.
Yeah, definitely patients with language barriers. That's another thing I look at, is that if it's a patient that doesn't speak English, those consents, those forms, and communication regarding their care. And thank you, Pat, because that is another one that I really focus on when I go to hospitals. making sure that it's a language they understand.
That's right. That's right. But yeah, I had to put that in there, Marcy. I know you're laughing about that. It's the truth. He said, I ain't leaving this church. My mama, okay, then fry. You just die spiritually. Go on, okay. Go on it. Go on, do what you need to do. All right, you want me to do the next slide?
Yes, and I want to we can and I'll let people look at that and read that and impact that, and then I'll go through it for those that don't have their cameras up. But we know that Black patients experience significantly worse patient safety events in 6 out of 11 health indicators compared to whites with the same gender, treated in the same hospital, and have similar insurance. So this is not in our head, guys. You can walk in an office and know when somebody doesn't feel really good about you and
Yeah.
doesn't respect you. We as a people have become very in tune to that. And we know when someone's not treating us fairly or right. And so if you feel that way, you can have that discussion, but always know you can always look for another provider.
Mm-hmm. Mm-hmm.
And I do want to say that the new cardiologist my mother has is probably the best in San Antonio. He is amazing. And
Okay.
so, again, everything's not negative. We left, as you said, that old church. We went to the new
Go to the new church. Okay, go to the
and
new
she
church.
is being well taken care of. He sits down and he talks and he spends time. And I know that the way our healthcare system is, you got to get him in, get him out. I get
Yeah.
that. But Marilyn, I was in Mexico 2 weeks ago doing
Right.
a presentation just with some docs. And when I heard how those doctors treat the patients, it was like nothing I'd ever seen. They sit down, sometimes they run behind, but they said they explain the meds, they give you a chance to ask questions, they give your daughter. I have sat in my room, as I'm sure my sister has, because both of us support our mom. We ain't gonna let nothing happen to our mother. I can tell you that I have been in a room sometimes and providers have walked in, nurses, doctors, techs, and not even acknowledge me. And
Exactly.
that's horrible. That is horrible.
You
So
know,
when we, uh-huh.
I'm sorry. When you were talking about insurance, I wanted to get this in because Annabelle said it is very important to know what your insurance takes care of, really, or you can choose to be
Yes.
admitted for the allotted amount of time your insurance requires. Now, that's another issue, and that's a whole
Uh-huh.
different conversation.
That's
When
right.
they look at your insurance first, okay,
They're
and
not.
then they decide on what you're going to do,
Absolutely.
okay, and I'm like,
Okay. So
that
I
is
have another
crazy.
story
Go
for
for the
that one.
story.
Anna is dead on. A colleague of mine had complained of she had high blood pressure. But when she went to the hospital, she basically went to the hospital. I'll never forget this. She went to the hospital because her speech was slurred. She felt she
Mhm.
had had a stroke. She was in between, her and I were working at a hospital together, and she quit, but didn't get a job in time enough. So she didn't have insurance, basically. And so they took her blood pressure, saw that it was high, and so they put her back in the emergency room. And then once they realized she didn't have insurance, gave her like some medication, told her she needed to leave, but her blood pressure was still high enough that she probably should have been seen. But she knows that she should have been able to stay because with the slurring of the speech, she was having a stroke.
Wow.
So she did go home because she couldn't make them keep her. She ended up paralyzed on one side.
Ah,
She
ah,
did sue them, but what does that mean? She's not able to work.
wow.
And so she could prove that once they looked at her insurance, Anna, they determined that she didn't have insurance. So they did a quick band aid and sent her out and told her to follow up with a primary care at one of their free clinics. And basically, she ended up having, full blown stroke, and she is paralyzed on her right side. And so that was something that was unnecessary.
Unnecessary and preventable. Man, this really speaks right into Dr. Conway's when she said our people suffers from post-traumatic
Yes,
syndrome from inadequate care physically, mentally, and spiritually.
absolutely.
So
Totally.
mentally, where is that person right now? We're only talking about the physical part, but they can't have any type of health with mental health. Okay? So where is she right now mentally? Where is her
Absolutely.
spirituality? You see, so no, that's a powerful statement right there.
Yeah, that
You
was
know,
very powerful.
yeah.
And so I just gave some things that we know are biases. Physicians with implicit pro-white biases were more willing to prescribe narcotic medication to white patients following surgery than black. It's a known fact that for some reason our healthcare industry at times can believe that we have a tolerance for pain. So you'll look and you'll find we get less pain. Now, when you look at history from women's health perspective, gynecological surgeries were created, and I can't remember the doctor's name, but if I need to come back and put it on your page, I will. But he actually performed the surgeries on black women with no pain medication. So he did hysterectomies, he did all types of gynae surgeries, and these surgeries were done without medication. And it's a well-known fact. And
Wow.
so I don't know where this stems from. I won't pretend like I know. I'm not a complete Black history buff like I should be, but I do know that it is an issue. And so we've got to speak up. We are not drug seekers. We also know Black patients are often sent home from healthcare facilities. COVID really showed that
Mm-hmm.
because patients were sent home. I know stories, and I'm trying to think of the name, and I had written it down. There was a sister, and I don't know if you guys remember. She was a doctor who had went and actually posted on Facebook. You could see her literally sick. I think it was Dr. Susan. Let me see what her name was. I'll keep talking, but it was Dr. Susan something, and she literally was trying to tell them that she was sicker than what she was, and they would not treat her, and they kept sending her home. The sad part about it is she ended up dying. She ended
Wow.
up dying. And then there was another sister in Maryland, Dr. Susan Moore. That's her
Okay.
name. So
Okay.
you can look that story up. And then Dr. Shimmery Smith was a school teacher who kept going back and forth for months, telling them that she felt sick and that she needed to be seen. And they later found out that she actually had what's called um, it's a COVID symptoms that persist. They call it COVID long haulers.
Long haulers. Yeah. Long
And
haul.
so she had that, but because they wouldn't listen to her, she wasn't getting treated. She actually in Maryland spoke to the legislators about what had happened in her experience and
Wow.
how she was mistreated as a person of color.
Pat Martin said even physicians of color are guilty of underprescribing pain meds to people of color.
Yeah,
Okay.
that
So
that bias can be on anyone, but especially on those that are have those stereotypes. But you know what? Sometimes we have those stereotypes too.
yes.
Dr. Conaway knows in a hospital that she works at where we have African Americans treating African Americans. Sometimes we have reverse racism. We do stuff to our own people, and it's not appropriate.
It's
It's not
not.
appropriate.
It's
It
not.
is not.
And that's a whole different show, which I'm going to
Yes,
bring.
please
It's
do.
called Us Versus Us.
Yeah,
Okay,
come
so
on now.
I want everybody to look for that one. It's coming up in Juneteenth in June. It's called Us Versus Us, but this time it's on another topic. It's going to be women hating other women. Why we do this? Okay.
Come
Hey.
on.
Okay. So if you want to be on that show, write me, and I'll let you on it. Okay. So it's Us Versus Us. So
The next
you want?
slide, because
Okay.
yeah,
All
yeah.
right.
So we know what happens when we speak up. We improve our outcomes. We improve our patient satisfaction because your experience is better. You have good things to say about the way they treat you. Better care coordination when you're able to speak up and say, I need to this doctor. Oh, you got to go to your primary care. Oh no, but you got to go to this doctor. It's hard coordinating all those services. So being able to speak up and say, I need some help and I need you to get a social worker to help come in here and help me empowers you, helps you be able to advocate for yourself. And we've seen several studies, Marilyn, that have shown that patients tend to trust more in providers that support them and that share their racial background.
That's
So
right.
we saw a study where Black male patients who saw Black doctors were 56% more likely to get a flu shot. We
Wow.
saw 47% were more likely to do diabetic screening. 72% were more likely to accept a cholesterol screening. These patients were more likely to engage. The problem is only 5% of the practicing physicians are Black,
Wow.
and 6 to 8% of the nursing profession are Black. That means we've got to do better with getting more Black physicians and Black nurses. There was a study in Illinois that was done that showed Black babies did better when they were with Black pediatricians. Now, I'm not advocating and saying all white doctors are bad. That is not the case.
Right.
But I do think that there's research that shows we think a little bit different and we go a step further. And we understand if somebody says, I got sugar, I don't judge you. I know you meant diabetes.
That's right.
I know when you said peeing like a racehorse, that you meant you going to the bathroom too frequently.
Okay.
So the culture, I understand you differently.
That's right. You understand the talk. It's like when you said she's a pistol. You know, just the name of my show, girl. Who don't you know? Everybody don't know that.
And you know what? You're exactly right.
Everybody don't know that I'm talking about that. Okay. Anna said, thank you so much for this wealth of knowledge. I have factual information to share about senior citizens I see every day. And that's a whole other story about coming to see your loved ones in a senior citizen facility.
You've
got the ones that the patients come to, the kids come, they treat them different.
They do. They do.
Okay. They treat them different.
They do.
So if you're out there and you're like, well, I don't want to go see Uncle John. He say the same thing. Well, you need to go anyway and say the same thing.
Come on now.
Thing to Uncle John. Because Uncle John, you don't know what they're doing to your loved one. He's there 24/7. But when you show up, they know somebody coming. In fact, they start to clock you almost. They know.
You better say that.
Who's coming, who's not coming, and they treat you different.
They do.
And that's all about health literacy as well. Understand it's just not going to the doctors. It's all type of health care, no matter where.
That's exactly right. That's exactly right. Yeah, you're right. So just because I know in the interest of time, I don't know if anyone has questions, but some sample conversations to give to your seniors would be on the next slide.
Okay.
So just some advocacy tips and questions to ask. You want to know what's the name of the doctor. If you go to a hospital that has a bunch of residents and different doctors and people coming in and out of the room, you want to know who's the attending, because it's fine that students have to come in and they have to see you, but you want to know the name of your doctor. You want to know who is seeing you. Everybody got scrubs on. Who's the nurse? Who's the nurse's aide? Who's the medical assistant? You want to know the name of the nurse taking care of you. Sometimes in the hospitals now, they put names on the boards, but if it's in a clinic setting, you might not get that, but you want to know who you talk to. Again, did you wash your hands before you walk in the room? I just changed somebody's dress and now I'm gonna come and touch you? No. Ew. I'm gonna have you protect me. And then you want to know what's the plan of care. You just can't throw stuff at me. What are we talking about? Okay, if I get my cholesterol down, you want to put me on drugs. Well, how about can I try to eat better? Can you help me get me a nutritionist? I don't want to be on those drugs if I don't have to take it to bring my cholesterol down. Are there other things I can do? Oh, okay. Let's talk about what that looks like. Oh, what's the name of this medication? What does this medication do? What does it interact? Can I take it on a full stomach? Can I take it on an empty stomach? Every 6 hours or Q4. What does Q4 mean? What does Q6 mean? These are jargons that we need to explain to the patients we take care of. Is there any issues that I need to be watching for? So if I start to have chest pain because I didn't take this medication you have, what should I be looking for? Oh, it's on the, down to the right side. Oh, okay, that's the sign and symptoms of a stroke. Help me understand so that I can better advocate and make that phone call and tell you, hey, when you told me this was going to happen, I'm calling you now. Go to the nearest emergency room. But you've got to be aware of what's going on with your body and what's happening. If they order a procedure, there is nothing wrong with saying, what is this procedure for?
Mm-hmm.
And then how many times have you performed? I shared with Marilyn a story. I was at a church, and I do this just free of charge. I just really want seniors to know how to help themselves. And a lady was in a wheelchair. She had just had knee surgery. And she asked me, she said, I had surgery. I had some problems with my knee. She could walk, but she just needed some surgery, a knee replacement. And so I noticed that she was in a wheelchair still. And she said she went back to the doctor like 4 or 5 times, and he kept saying everything is fine, dismissing her. She goes to another doctor who does a CT and finds that there is a drill bit where they did the surgery left in her knee. I can't make this up. Remember, I told you those issues that are in surgery. That was another thing, foreign body retainment. And so she went back because the one doctor that found it said, I'm not, of course, he's not going to touch her because he didn't do that. And he didn't want anything to do. Now you have to try to find someone to take care of that.
Wow.
She's
Wow.
past the statute of limitations because she's been going back and forth for litigation. And she said the provider actually told her that that's common. See, I'm going to have a problem when you lie and say that it is not common.
It is
and if
not
it is,
common.
it shouldn't be. It shouldn't be.
Really?
And the naivety of her hurt me so bad as a woman of color. That could have been my mother. That could have been my aunt. To think that someone lied in that manner, it so hurt me. And I stayed after and talked to her and tried to connect her with some support and some help because that was not right. It just wasn't right. It just wasn't right. You also want to make sure that if you sign a consent, that everything explained to you. You want to know the risks versus benefits. If I don't have this procedure, what would be the worst thing that can happen to me? And if I do have it, what would be the worst thing? Because you want to make sure that they've given you the information. And then you want to be watching for after surgery. If I have drainage or discharge, before you go home, you want to know what should I be watching for, that if I have an infection, I need to call you back. And then finally, discharge instructions. Make sure that they have a contact name and information and when you should call at all times.
Right.
So
wow.
I'm open for any questions. I
mean, questions, and I just want to start right now and say thank you, but I want you guys to get your cameras out, get your phones out, and take a picture. Take a picture of this one right here, because you're going to forget it and you need to know, okay? And then here, Pat Martin said, draw a picture if you need to.
That's right.
You want to teach back with the patient. Some people may say they understand to hide the fact that they read at a lower level. You'd be surprised. That is so true.
That is so true.
To explain to them. And I'm going to tell you another thing. When you're dealing with Latino patients, sometimes they got to bring their 9-year-old or their 10-year-old into that room in order to translate for them as well. So I've had it when in dentistry that the little boy would have to take off school to come in there with his mom in order to translate. Okay. So
so Marilyn, with that one, you're right. But so in healthcare, you have to have an interpreter that speaks the language that the person speaks, because what happens is sometimes with youth, they don't know the right body parts or the right way of
Exactly.
describing, right? So
Hmm.
hospitals, and I think President Obama put this in, I think it's health, it's ACA like 1567 or
Right,
1557,
right.
which requires that anyone that
Hmm.
goes into a hospital that doesn't speak a language, that someone should be there to interpret so that they wouldn't have to use a family member. I actually had a patient who didn't want to get pregnant, and her husband was interpreting, and I knew he was lying. He wasn't telling her what I was saying.
But
So
what
we
I'm saying,
bought an interpreter.
let me interject real quick. But I was getting ready to say you need to have an interpreter there.
Yes,
They did
absolutely.
not have an interpreter there. So this little kid is missing school to come in to
Oh my
interpret. So
goodness.
any place that you know, you got to have all type of languages, or you need to have a
That's
place
right.
where you can dial up and get someone to
That's
translate
exactly
for you.
right.
That's what I'm saying. You need, like Pat
Absolutely.
Martin is saying, you need a certified medical interpreter. You're right.
Absolutely.
But all
Absolutely.
places in small cities, small towns, they don't have it. But
Yeah.
they do have phones that you can call and say, hey, I got someone here who's speaking Spanish. I need to do
Yes.
this. So that's what I'm saying.
Absolutely. And a lot of the hospital, to what you're saying, Maryland, have what's called Stratus and another
Hmm.
it looks like a computer or an iPad, and
Okay.
the person physically is on there, and it really works well for deaf people. I see a lot of hospitals are using that as a way to communicate.
Yeah, that's a good thing. So, hey, we got any questions out there? It's been almost an hour. Okay,
Yeah, I'm
Dr.
sorry.
Conway
I'm
is
just
saying, no, that's right. That's good. That's good. That's correct. Need to have a trained interpreter or software devices. They should have one because it's not just speaking Spanish. You got people that speak. I used to work at a dentist office that my clients, it was Bosnian. And I had to
yeah.
learn how to say, open your mouth, turn your head, all of it,
Yeah.
but my dentist supplied them for me, but I had to learn it. I mean, I just think that it's respectful to learn it anyway. So,
I
hey,
agree.
any questions out there? Because, Jackie Morrow Kinkle said this is some good stuff. And you're right, it is. And I'm hoping that it has been good. I hope it has enlightened everybody to understand that you do have a voice. Okay. And so
Absolutely.
please understand that and don't just let anybody, I say this is an old term, don't let everybody sell you a wood nickel, okay?
Hmm.
So don't
Hmm.
don't don't allow that as well. So Dr. Jones, this has been good. And
And I thank you.
I certainly do appreciate you coming on the show and just telling us some basic common sense things in some sense. But sometimes we need to get someone to tell us, okay? And then you also said, please remember, as a patient, know that your voice is important. What is
Absolutely.
Dr. Jones? She's saying that it is important because nobody knows. They might say one thing, you're like, no, that's not what she had. No, that's
That's
not
right.
what she did. Can you bring somebody else in? Can you do this? Get a second opinion, get a third opinion. Keep
That's
going
right.
until you're okay.
That's right.
Okay. And don't let anybody tell you about, well, you don't have insurance. They don't say that because they'll be showing a bias or a prejudice. They won't
That's
say that, but it's other things that you can pick up on that they're only doing this because I don't have the right type of insurance. And that's
hmm
not a good thing. So, but are there any questions or comments? Let's see what we got here, Dr. Jones. Let's go all the way down. Let's see what she says here. Annabelle said, I've learned so much. This sample conversation is like turning on a light bulb in my head. Go on, Anna, get that light bulb turned on. Okay.
You so silly.
Okay. And Jackie Morrow Kinkle says it's called Holding Medical People Accountable. All
That's
right.
right.
And Pat Martin said, this was great, ladies. We can always learn something new. You're exactly right, Pat. And I'm so happy that my friend, my colleague, I mean, the brain trust as well, she's the person to go to, if you got questions or concerns, it's important that and but me, I'm the girl who don't I know. So if you want to contact if you want to contact her, you guys can reach out to me. There's
Absolutely.
my email right there. And if you want to come on my show, I keep telling you, you can come on. Don't be shy. Don't be shy. Okay, you can come on. And so today we were talking about healthcare literacy and health outcomes. Okay. And
Thank
so understand that you are the person that has the real voice. So I'm going to end for tonight. And my final words, just like Jerry Springer always has, find your voice and use it for your health. Okay. And for your mama and them's health. You know the story. Okay.
That's right. Take care of your mama and them.
Take care of your mom and them. And you have been listening to Girl Who Don't You Know is my talk show, Marilyn Green. So I'll see you in a couple of weeks. And when we come back, it's gonna be what are we talking about next time? It's gonna be good. I forgot. Okay. No, I know what it is. Forgive me. We're going to be talking about financial literacy because this month of April is financial literacy. But I'm going to bring it from perspective of your children because so many times we've grown up and we don't know how to do money. Okay, and I'll use myself. The bank book says I got 100, so I'm gonna spend 100, but I already spent that last week. So you got to know how to do things of that nature. So next week is going to be financial literacy, and we're going to be coming from the posture or the slant of children out of a children's book. So I will see you in 2 weeks, and thank you, thank you. Oh,
Thank
some more
you.
comments. We got to get them all in, okay? Let's see here. Wait, hold on. I'm doing it. I'm doing, I'm a baby boomer. Okay. Here we go. I love this one. When you know better, do better. You know it, Dr.
You know
Conaway.
that's right.
And Annabelle's the outstanding. And this I'll top it off by saying exactly. So thank you guys so much for
Thank
coming on.
you.
And don't be a stranger. You can come back and see all my other shows that I did before, or you can come forward and see all my shows as I go forward. So you take care, and it's been
Thank
really a
you.
nice time with you. Bye bye.
Thank you so much, Marilyn. Bye bye.
Bye bye.